Hello and welcome to the Dolph C. Simons Jr. Family Broadcast Studio here inside the University of Kansas Health System. We have an update on our due diligence with Liberty Hospital. During this virtual news conference, you will hear first from Dr. Raghu Adiga. He is the president and CEO of Liberty Hospital. Then you'll hear from Tammy Peterman. She is the president of the Kansas City Division of the University of Kansas Health System. And then finally, you'll hear from Bob Page. He is the president and CEO of the health system. We will also be taking reporter questions after we hear from our speakers, and you can get those to us three ways. You can put them in the thread anytime during this chat. You can put the raise your hand button, and then we'll know you're on the call. And then you can also just speak up when I call out for questions. Just please make sure that you tell us your name and also your media organization. But for now, I'm going to hand it off to Dr. Adiga, who was with Bob and Tammy at Liberty Hospital in Liberty, Missouri. Hi, good afternoon, Dr. Adiga.
Hi, good afternoon. Thank you for having me here, and thank you for all the reporters online there. I'm really excited today to announce that Liberty Hospital has signed a definitive agreement today to join University of Kansas Health System. As you know, this is a process that we started exactly 365 days ago when we announced that we are looking for a partner. We're talking about the right partner for our patients, right partner for our staff, and right partner for the community. I'm really excited that we all came together, the senior leaders and the physicians who advised our trustees. And in October, we made an announcement that University of Kansas is going to be that partner. And we had a letter of intent signed at that time. And since then, we started the due diligence process, and there has been a lot of information exchange between the two teams. And today, we had the Board of Trustees meeting this morning, and unanimously, our trustees agreed for the agreement that we have, and that has been signed. And we're looking forward to our partnership together. And I've been here in the Liberty area now for 20 years taking care of patients. And I'm really excited about the future together, the things that we can do together for the patients with the systems such as University of Kansas Health System is phenomenal. And the team is entirely excited here in the hospital as well. Tammy?
Sure. We're so excited for this day. We're excited for this opportunity here in Liberty and for Liberty Hospital to join the University of Kansas Health System. When Liberty Hospital selected our health system as their partner, we were so looking forward to this journey together. We just knew that there would be great opportunities for us to learn about one another, our organizations, our plans, our vision, all of those things together. And here's what I will tell you, and here's what I know. Just like the University of Kansas Health System, Liberty Hospital focuses on patients. They focus on patient from at the center of their decision making, always looking at what is best and right for patients. I also know that we have very similar cultures. Our cultures are focused on those patients, focused on quality, focused on patient satisfaction, on service to our patients, and of course, focused on our people. Those things are really similar with our organization, the University of Kansas Health System and Liberty Hospital. I think that makes us a great partner together. We've also had the opportunity to get to know some of the leaders at Liberty Hospital. There's some great leaders, and we're so appreciative and grateful for their leadership. And certainly one of those great leaders is Dr. Adiga. His vision, his passion, his drive to always do what is best and right for patients and for Liberty Hospital, that has been clearly evident as we've gone through this process. We know that it will take Dr. Adiga and his team as we continue to work through this process, and we're grateful for all that they've done and certainly for the opportunity to work with them. Having Liberty Hospital as part of our health system makes great sense. We take care of patients from every state in the country, nearly every county in Missouri, all but just a handful of counties in Missouri. 35% of our patients come from Missouri, and certainly we're taking care of a lot of patients from the Northland. This makes great sense for us. We also know that it's so important as Liberty and the Northland continues to grow that there will be opportunities for the care they need to be received right here close to home. We will be bringing some additional services to Liberty, certainly the University of Kansas Cancer Center. The area's only NCI-designated comprehensive cancer center will be bringing to Liberty. We've been caring for patients in the cancer care world for many years. We've had a lot of opportunity to care for cancer patients in the Northland. This will continue to help solidify our leadership in cancer care here in the Northland. We know that this was a big decision for Liberty, and we are so grateful for that opportunity. I will tell you, I believe this is best for our organization. I believe this is best for Liberty Hospital, and ultimately, and most importantly, I believe this is best for patients. We're honored for this opportunity and look forward to all we're going to do together. Bob?
Yeah, Tammy, you know, it's an incredibly exciting day here for our organizations and for this community. As Raghu said, it's about a year ago that Liberty Hospital and its leadership embarked on the journey to select a partner. And on behalf of the entire University of Kansas Health System, I would like to thank and recognize the board of Liberty Hospital, Dr. Adiga and his entire team for the courage and the wisdom it took to embark on this journey. These are unprecedented times in healthcare, and it takes forward-thinking leadership to move forward with the selection of a partner. When I think about some of the facts and characteristics that brought us here today, there are two that come to mind, and Tammy, you've touched on both of them. One, when we select partners, we focus on cultural compatibility. From the moment that we started working with Dr. Adiga and his team, we felt that the cultures of our two organizations were very compatible. The other thing we look at is leadership decision making. And what we saw here at Liberty was the same decision making process we use, and that is put the patient at the center of every decision you make. That has served us well for 25 years. We believe it will serve this combined entity well for the far-reaching future. Liberty Hospital has a proud tradition in this community, and I believe it is a fundamental piece of the fabric of the community here in the Northland. Our commitment to the folks here at the hospital, as well as this community, is that we will honor that tradition, and together we will continue to enhance the services available for people in this community. Now, there's clearly a renaissance going on in Kansas City. The University of Kansas Health System is proud to be one of the centerpieces of that renaissance. As the only locally owned and operated health system in our metro area, we look forward to 5 years from now when we all look back and we smile about what we've been able to do together to improve the health care of this community.
Thank you, Bob, Tammy, and Dr. Adiga. We do want to check in with any news media right now, and while we give you a chance to unmute yourselves or write your questions, I do have a follow-up question. You mentioned significant investment in Liberty Hospital over the next 12 years. What do you mean by significant?
Well, I'll go ahead and take that one, Jess. What we have in our agreement is we have committed over $300 million in investments over the next 12-year period. And those investments will cover a variety of topics. Clearly, technology will be one. Another will be facilities. Another will be people, recruiting physicians to add to the already great team that's up here. But that's the magnitude of that commitment that we are making to this organization that will help us do the things we believe are necessary as we go forward.
And when we brought on Olathe Health, we were asked frequently if there would be any layoffs or reduction in staff. Any planned changes in staffing at Liberty Hospital?
Tammy, I think you can take that one.
Sure, Jess. I think it's important to know that all of the employees at Liberty Hospital and the employed physicians will become part of the University of Kansas Health System.
Well, in keeping patients first, as you have mentioned, will patients notice any immediate changes in their care or access to their regular primary care?
I think we'll let Dr. Adiga answer that one.
Yeah, no, absolutely not. Our patients will continue to receive the same care from the same physicians, same providers. Starting from July 1st, they're not going to notice anything differently. It only will be enhanced as the time passes. They will have more access to higher level of care and be able to have a seamless continuity of care. So no, we do not expect to anticipate any kind of changes.
We want to give a last call out for media and see if you have any questions.
Hi there. Can you hear me?
Sure can.
This is Reagan Porter. I'm with Fox 4. Wondering how the deal is restructured, and will Liberty Hospital now be managed, or will they manage themselves and operate themselves, or will they now operate under the University of Kansas Health System?
Dr. Diga, you want to take that?
Yeah, I'll take that. So the Liberty Hospital is actually currently operated by the New Liberty Hospital District. That's the governing body. Going forward, the district will still remain, but they will be mostly managing the fixed assets. But the operations will be turned over to New Liberty Hospital Corporation that has a membership substitution by the University of Kansas Health System. So in other words, University of Kansas Health System will be operating going forward.
Last call for media. Any other questions?
Thank you. And previously, there has been some opposition from lawmakers on this partnership. And there have been bills that were underway requiring legislative approval. Where are those bills on that? And what can you say regarding that?
I can take that on the Missouri side. Yes, there were a couple of bills that were being proposed in the Missouri legislature, and we've spent a lot of time with those legislators and political people involved, educating them about what we are trying to do here. And all indications are that there is no further progress on any of those, and we don't anticipate any legislative hurdles to this partnership that we're envisioning.
On the Kansas side, there have been some allegations perhaps that Kansas law has been implicated. We've done our due diligence. We've worked with legislators. We've worked with the other folks in Topeka to make sure that everything that we've done in this transaction is perfectly allowed under the Authority Act that created us. So we're very confident that we're on solid ground and just look forward to moving forward.
Any other media questions?
Any last message to the people who will be receiving care?
Certainly, I can take that one. For patients, as I said before, this is, having been here for 20 years and knowing these patients, treating them, and living in this community, I can tell you that I'm super excited about what's to come. And in addition to the level of care that you've received now, this is what I've understood from interacting with people at University of Kansas Health System, the leadership, the physicians. I totally understand when they say that they want to bring this high-level care to their doorsteps, to their community. That's what's going to happen. We're going to be able to provide all this specialty care here, and when we do need even higher level of care, there is a smooth transition that we can provide and bring them back here for the continued care. I do believe that this is going to be truly something that we would be celebrating in years to come.
Dr. Diga, you're excited about this, and certainly your team is. And I think it's important to note that the University of Kansas Health System is also excited about this. This is a great opportunity for us to work together to continue to provide care to people across our community.
One of the other things that everyone knows is the importance of physicians and medical staff members. We also know in our 25-year journey that you can't have a great hospital without great nursing. Tammy, you may want to talk about the commitment that we're collectively making for the Magnet journey.
Sure. The University of Kansas Health System is a Magnet designated organization. We've been designated 4 different times consecutively, and we are committed to bringing that opportunity to Liberty Hospital as well. We know that I've said for many years you can't have a great hospital without great nurses, and I know that, and I see that, and I believe that. And certainly you have to have great physicians, you have to have a great staff, and we know that those exist at Liberty Hospital. We want to continue that journey of nursing excellence, and we'll start on the Magnet journey at some point as well.
Last call for media questions. Well, this concludes our virtual news conference. Reporters will be sent a news release and a summary of the high points related to the agreement we just spoke about. So watch your news desk inboxes for those documents. And you can always go to medicalnewsnetwork.org for those documents as well. Thank you so much for joining us.